Mr. Speaker, amazingly enough, the Health Minister accuses the Wild Rose of being behind on the ER issue. The only one behind and in denial is the government. What is shocking is the minister believes he can get away with these accusations. The documents that we received discuss the widespread failure in the system, and it goes on to say how a young patient died after a 6-hour wait in the ER. How very, very sad and tragic. My questions are all to the Minister of Health. Daily demands for the hospital beds are not being met, Mr. Turner. When Minister,
the Honourable
are
Minister
you going to open
of Health and Wellness?
Thank you, Mr. Speaker. I believe the tail end of the question was about opening more beds, and I've indicated before that there are a number of beds opening. And so I'm going to talk about additional beds that are being opened in acute care hospitals. I've mentioned them before. I think I gave out the Calgary stats yesterday. Today I'll give out some Edmonton stats. In October, 55 more beds were opened at the Royal Alec and at the U of A. This current week, about 16 more were opened at the U of A and at the Royal Alec. By the end of November, 44 more seniors mental health beds will be opened. And in December, Mr. Speaker, about 12 more detox beds will be opening.
Thank you, Mr. Speaker. I'm not talking about palliative care or rehab or continuing care. I'm talking about acute care beds. Since the minister has stated in the House that fixing the ER crisis is your priority and a top priority, will he legislate the waiting times that he aspires to?
Honourable Minister.
Yes or no? Mr. Speaker, I am aware that in some places around the world they try to legislate that, but I'm also aware of what her colleague to her right there from Calgary Glenmore said yesterday when he was talking about so-called successful European health systems, and then he cited France, where patients might be subject to co-payment charges for basic services such as hospital care, and he's making it sound like that's one two-tier system we should follow, and we're not going to follow that, Mr. Speaker. We believe in a single payer here. We're helping with the Canada Health Act.
Minister, Albertans want answers. They don't want your BS. The government continues to...
Call a spade a shovel.
They don't
withdraw that,
Mr. Speaker. The government continues to state they are open, and they state that they're accountable. Will the minister table in the legislature on Monday the minutes from the Alberta Health Service meeting this Friday on their strategy to deal with peak pressures in the ER?
The Honourable Minister.
Mr. Speaker, that's not my meeting. That is a meeting of a number of specialists that Alberta Health Services has invited. And let's be clear on what the purpose of that meeting is. The purpose of that meeting is to look at the very issues that were expressed to me and to others with respect to overcrowdings in some emergency rooms in some major acute hospitals. And that is why that meeting is occurring, to address those issues. It's time to get on with it and to focus on what's going forward, and that's what they're doing, Mr.